is Delegate Stadler. We call to order this meeting of the Joint Committee on Volunteer Fire Departments and Emergency Medical Services. I'll ask the clerk for a roll call.
Senator Deeds.
Here.
Senator Caputo. Senator Hamilton.
Here.
Senator Martin. Senator Maynard. Senator Phillips. Senator Phillips.
He's here.
Say here.
You here, Rick? Here. Trying to find you another senator.
Senator Stover. Senator Taylor. Delegate Statler.
Here.
Delegate Bridges. Delegate Burkhammer.
Here.
Delegate Butler.
Present.
Delegate Garcia. Delegate Holstein.
Here.
Delegate Honaker.
Here.
Delegate Jennings.
Here.
Delegate Mallow.
Here.
Delegate Steele.
Council, has a quorum been established?
It has not.
In an effort to develop a quorum, we'll go ahead and we'll move the agenda around a little bit. We'll put 3153 at the end of our agenda. And so in the effort to elect one more senator for us. So we'll go ahead and start with our speakers. Today we have Carrie McKee-Lou. Help me with your last name. Mika-Lou, okay. And she's the director of West Virginia Behavioral Health and Workforce and Health Equity Training Center at Marshall University. And we thank you for being here today. Thank you for stepping up a little bit early. And as part of our protocol, we always swear in our witnesses. You swear that the testimony that you give before us will be the truth, the whole truth, and nothing but the truth, so help you God? Very good. Thank you.
No, I'm good. Good afternoon, everyone. I just want to start out by thanking you all for the invitation to speak at this meeting today. Speak louder? Okay. I'm Dr. Carrie Mika-Lou. Again, I want to thank you all for inviting me to this meeting this afternoon. As mentioned, I'm the director of the West Virginia Behavioral Health Workforce and Health Equity Training Center here at Marshall. I'm also the founder and CEO of Aspire to Inspire Behavioral Health and Addiction Services. As part of Aspire, I'm also the co-founder of Code Gray, which is a workshop that my husband and I developed that focuses on first responder wellness. And I'll be talking a little bit more about that here shortly. A little bit about my background. I'm a professional counselor by trade. I've been a therapist for over a decade at this point, primarily specializing in trauma and specifically working with first responders. I also have training and national certification as an EMT myself. I'm not currently active because I have a lot of things going on, but my husband is a firefighter EMT whose service was interrupted by PTSD in the early 2000s. So this is a topic that's close to my heart, I think for obvious reasons, and I'm going to get into what I'm talking about here today. So starting with my research, which focuses on first responder wellness, specifically my doctoral dissertation focused on the dehumanization of first responders and the impact that that has on their wellness as well as the workforce as a whole. I looked at variables that contribute to a reduction in the first responder workforce, whether that be through death, early retirement, attrition, or simply decreased effectiveness on the job. So specifically, my research examined workforce threats including suicidality, burnout, and diminished self-efficacy. I think many of you in here probably know that suicides among first responders have been outnumbering line of duty deaths for at least the past several years. And then things like burnout and decreased self-efficacy are contributing to those early retirements, that attrition, and that decreased effectiveness on the job. People have been leaving this workforce in record numbers, and that leaves those who remain at even higher risk of burnout and mental health concerns than they were before, due to that severe understaffing and therefore excessive workload. Unfortunately, public stereotypes and the tenets of first responder culture have kind of exacerbated this problem. Public perception often involves very polarized stereotypes about first responders, right? They're either the superheroes or they're the bad guys. And then we have first responder culture that encourages a machine-like demeanor. And this imagery is indicative of dehumanization, which you can see the definition of it here. But very simply speaking, dehumanization is the denial of some aspect or aspects of a person's humanity. And there are different ways that a person can be dehumanized, as you see here. So we have less than human or animalistic, inhuman or mechanistic, or more than human, which I call deistic. The most common example of animalistic dehumanization as it relates to first responders are when we see police officers compared to pigs. Mechanistic dehumanization is apparent in first responder culture, which emphasizes toughness, vigilance, and stoicism, essentially encouraging a machine-like demeanor and shutting down emotions for the sake of the mission. Now, I do want to acknowledge that being able to compartmentalize when you're actually on shift, for example, that's helpful. Because if you're on an active scene, you can't be a basket case, right? But what we've seen is that this now becomes overgeneralized. So it's not just a workplace persona anymore, but becomes the first responder's way of being. Then there's the superhuman or deistic form of dehumanization. We see all the time first responders compared to superheroes, right? And although it's well-intentioned, it implies superhuman capability without allowance for human vulnerability. And we saw this during COVID, right? Healthcare heroes campaigns were everywhere. And while they were probably intended to show reverence and appreciation in the midst of the chaos that was COVID, it's important for us to consider the underlying message of such slogans. Because superheroes don't need help. Superheroes don't need rest. Superheroes are there to protect and save the rest of us. So this unintentionally deprives the first responder of humanness and a need for care. So my study looked particularly at the experiences of the first responders themselves. So I wanted to measure their perception of being dehumanized. And there's a term for that. It's known as meta-dehumanization. And this refers to the degree to which one believes they or their group are denied humanity by others. So I wanted to examine first responders' experiences of dehumanization from both their organizations as well as the general public. So for the organizations, that's organizational meta-dehumanization, and it's how much do I believe that I am dehumanized by the organization that I work for or am affiliated with. I also wanted to look at their perceptions of dehumanization from the general public, and then the impact of those experiences on the workforce threats that I mentioned a couple slides ago. So anytime you're putting together a research study, you of course have to look at what's already been done. So in looking at how dehumanization relates to workforce threats, it has been linked to things like decreased job satisfaction, increased turnover, poor job performance, and other workforce threats in a variety of populations. There was one study, for example, of over 1,100 healthcare workers that found a positive connection, a relationship between dehumanization, moral injury, and suicidality. There's also a phenomenon known as defensive dehumanization, and this is very specific to helping professionals. And this is where helpers dehumanize the people that they're helping as a means of self-protection. Additionally, burnout among helping professionals is sometimes defined as a state of apathy in which helpers protect themselves against the stress by adopting an uncaring attitude. Probably not something that we want to see in our frontline workers, right? Burnout has other consequences for the workforce as well. things like absenteeism, turnover, decreased productivity and effectiveness, but perhaps the most concerning for first responders, impaired judgment and increased likelihood of accidents. And of course, low self-efficacy is also problematic and negatively impacts things like job satisfaction, workplace well-being, and turnover. So that leads into my actual study. I ended up with 211 first responders from across the United States and Canada that participated, but almost half of the study was located right here in the southeast region of the United States. The first responder roles represented were EMS, law enforcement, fire service, 911 dispatch, and hospital emergency department personnel. And to make a long story short, the findings of this study did indicate that first responders do experience dehumanization from both their organizations and the public, and that those experiences significantly threaten the first responder workforce by contributing to those workforce threats I mentioned: suicidality, burnout, and decreased self-efficacy. I think it's important to note as well that specific profession was also a significant predictor of meta-dehumanization and burnout. Law enforcement and EMS, for example, experience higher levels of meta-dehumanization and burnout than firefighters. So what does all of this mean? The findings of this study, particularly in combination with the studies that came before it, have a number of possible implications. This study has demonstrated that first responders do experience meta-dehumanization and that those experiences significantly predict threats to the workforce. I mentioned some of the previous research findings earlier, but some of the other serious consequences of meta-dehumanization include things like emotional exhaustion, poor job performance, moral disengagement, and increased tendency to dehumanize others. So that reciprocal defensive dehumanization we talked about earlier. So taken together, this really reinforces the idea that not attending to the needs of the helper is certainly harmful to the helper, but it's also harmful to those they're charged with helping. So what do we do about this? So we know that the findings of this study indicate that mental health concerns and workforce threats may merely be symptoms of a much larger issue, which is dehumanization. We also know from other studies that dehumanization can lead to a number of different workforce-related threats, right? So it really behooves organizations, leadership, and policymakers to go upstream, so to speak, in an effort to identify and address root causes. So first, it really needs to begin with acknowledgement. Like, we hear you and we believe that this is a thing that's happening. Now, admittedly, meta-dehumanization does refer to perception, and perceptions aren't always accurate, right? But even if first responders' perceptions of dehumanization are not objectively true, perception is reality, which means that the objective accuracy or inaccuracy of the perception is unlikely to influence the consequences. So that's something that we have to be mindful of and willing to accept. Now, while first responder professions are inherently stressful, that can't necessarily be changed, right? The work is the work, the job is the job. But working conditions are within control of organizational leadership, and they need to be held accountable for those conditions. So how do we do that? Well, some things are going to be site specific, but I do have some suggestions. So first, and perhaps most importantly, we do need to continue decreasing stigma around asking for help. So in some cases, this is going to involve a major cultural shift, focusing on destigmatizing language and attitudes, developing more robust EAP services, adopting the provision for PTSD as a workers' comp issue, and or providing financial assistance to workers who wish to seek mental health care. Adopting the workers' comp coverage in particular would be a big step in the right direction toward acknowledging that PTSD is a thing and that it's a work-related injury for first responders. Because really the liability isn't in someone needing mental health care, it's in needing it and not feeling like it's safe to ask for it. We also want to improve working conditions as much as possible and to do so in a way that's meaningful, right? Self-care can only go so far when we're talking about things like burnout. Continuing to preach self-care at that point is just adding insult to injury if nothing is being done to address the root causes of the burnout. Same thing with employee appreciation events. Those are nice, but they too do not address the root cause. So this really requires a willingness for departments and organizations to look inward, perhaps anonymously survey their staff, and honestly assess what's going on, why is it going on, and what can realistically be done. Are the trucks in good working order, for example? Are the ambulances climate controlled? Do the boots on the ground have what they need to do their jobs as safely and comfortably as possible? Are steps being taken to ensure that shifts are ending as close to on time as possible? Looking at changes that could be enacted for attracting and retaining employees. I know there's been a major push for this. I attended the Behavioral Health and EMS Workforce Summit in September. I know there's a push for this. But being able to alleviate those staffing shortages, decrease individual workloads and mandatory overtime, and allowing employees to utilize their accrued time off. These are all things that are going to help the burnout problem. And I promise you, although pay is definitely a factor, we can't deny that it's not. Although pay is a factor, it's not the only factor that people consider when they are accepting or leaving a job. And that leads me into a final suggestion. One of the main things that contributes to whether a person stays at their place of employment is leadership and the overall workplace culture. What makes someone a good leader isn't just having the most experience or years on the job. It's their ability to cultivate relationships and see themselves as there to help their staff rather than boss them around. So ensuring that the folks who are already in leadership positions or are being promoted into leadership positions have appropriate leadership training. And I'm not just talking policies and procedures training, I'm talking about leadership skills training so that they know how to act like leaders that are there to support their teams. Because ideally, employees need to feel safe approaching leaders with problems or difficulties and have that sense of trust and mutual respect. So to kind of sum up the suggestions, I think back to Maslow's hierarchy of needs. And if you're not familiar with this, it's kind of that pyramid that has the most basic needs at the bottom and higher level needs kind of work up from there. So it starts here with a foundation of empathy, acknowledgement, respect, and validation. Hopefully this is already in place, but if it's not for a particular organization or department, it's a great first step toward rehumanizing the workforce. Acknowledge the existence of organizational dehumanization, or at the very least, burnout, validating the experience, offering empathy and respect, and ensuring that anyone holding or being promoted to a leadership position is trained to do the same. The next level, which builds upon the first, is enacting change. And to ensure that change is meaningful, it needs to be based on the needs of the workforce, which means hearing directly from the workforce. And once you've identified some root causes, work to make some changes that address them. And that leads me to the top of the pyramid. And by the top, we don't mean the best, right? This is kind of like the top of the food pyramid, the things that we're supposed to consume sparingly. So as I mentioned on the last slide, Preaching self-care to folks who are burnt out is grossly ineffective, if not downright dangerous. It also implies that the individual is at fault for their own burnout. Like if only they'd done more yoga, they wouldn't have burnt out. Self-care is an important piece of the puzzle. I'm not going to say that it's not, but in order for someone to take care of themselves, they have to have the capacity to do so. And they just don't have the capacity if they're already burnt out. It's like trying to put out a fire with 1 cup of water at a time. It's not going to work. And employee appreciation events, as someone who has worked in healthcare for the past 12 years, I've attended my share of break room pizza parties, right? They're nice, but they're a Band-Aid if the overall environment is unhealthy. So self-care seminars, employee appreciation events, these are things to be used sparingly and only in conjunction with the previous 2 levels. So as a means of moving things forward, I'm an educator at heart, right? I'm a strong advocate for further education, particularly for first responder leaderships and policymakers. I think everybody here already knows that first responders face a lot of stress on a regular basis, yes? Yeah. And they're confronting traumatic situations, sometimes multiple times in a single shift, sometimes back-to-back calls. And even without some of the added pressures we've seen in the 2020s, first responders were already experiencing high levels of burnout and conditions like depression, anxiety, substance use disorders, PTSD, at a higher rate than the civilian population. And those disorders are correlated with suicidality. I already talked about suicide rates on a previous slide, but I need to drive this home. Suicides aren't just outnumbering line of duty deaths. They're doing so even with suicides being underreported by as much as 60%. So in 2017, in response to what my husband had experienced as a first responder and what I had noticed throughout my career, we decided to develop a workshop called Code Gray. And the name comes from my time working in hospitals when, at those facilities, calling a code gray meant there was an urgent and potentially dangerous situation that required assistance. And that describes our mission. We believe that first responder wellness has become a critical issue, and our objective is to assist with managing job-related stress, increasing mental wellness, and preventing suicide. We need to attend to the needs of the helpers, but we need to do so proactively rather than just reactively. We need to go upstream in an effort to identify and address those root causes. We need to create a culture that destigmatizes stress and trauma responses, denormalizes overworking and the superhero mindset, and builds in healthy and trauma-sensitive workplace practices and sources of support. Because this can go a long way to not only alleviating PTSD symptoms, but potentially preventing them from taking hold in the first place. And this is what Code Gray aims to do. So since its inception, we've presented it all over the state. We were at PipeStem in 2020, right before COVID hit. We'll be doing this again at the Buffalo Volunteer Fire Department in September. And it focuses on first responder wellness, PTSD recovery, and suicide prevention. And it also provides suggestions for cultivating a more supportive and trauma-sensitive workplace. The workshop provides education on different types of stress and stress reactions, the role of first responder culture, signs that stress is becoming more than just stress, strategies for creating and maintaining that trauma-informed workplace, and options for obtaining professional help. And what really sets Code Gray apart is that we can address this topic from multiple perspectives. So I bring the mental health and the family member perspective on things, and my husband Alan brings the first responder perspective, and we both bring years of experience in leadership roles. And while it can and has been presented to the workforce at large, we strongly recommend it for organizational leadership to ensure that decision makers are part of the conversation. There is a shortage of both paid and volunteer first responders, not just in West Virginia, but all over the country. So this has to be tackled systemically. A cultural shift is required to ensure that first responders are seen as human beings with human limitations, and that needing and seeking mental health care is destigmatized. And that's what Code Gray strives for. And that's all I have for you. If there are questions, I'm happy to take some questions now. Otherwise, I'll be hanging out until the end.
I have a question.
Yes.
Have you presented your program to organizations like at the State Police Academy or at the Fire Academy? Have you had a chance to do that yet?
We were invited to present at the Tri-State Fire Academy a few years ago, so we have presented there. It was for all of Cabell County. We've presented at Wood County Fire School, Canova Police Department. So basically we go where we're invited.
Right.
Yeah.
And you feel like that leadership is interested in this program?
They have been very receptive. The folks who have reached out to us to invite us have been in leadership positions. Dunbar Fire Department, for example, when Chris Thornhill was the chief there, he's the one who reached out and specifically wanted us to do the Code Gray presentation there. So leadership does seem to be receptive, yes.
This is a topic that I've started looking at, and I'm certainly no expert at it in any way, but I do understand the burnout. I do understand that we're continuing to lose people out there because of stress is related. My question to you is, on all your studies that you've done, have you found anywhere else in any other states a model that they are doing that actually has proof that we're turning some things around?
I can't speak for other states. I've been impressed by the things that I've been seeing right here in Huntington. I know Jan Rader has kind of led the charge with really emphasizing mental health for first responders. So I think there are certainly glimmers that we're seeing right here in our state that could potentially be the leader for other parts of the country, which I think is ideal.
And I'm glad you mentioned the program here in Huntington. If we're talking about the same program, I came down during session and visited that program. And I believe it's funded through a grant that was got by the city. And I'm not sure how widespread, who all gets to come into the program. But I know going through and visiting a facility, it had a lot of workout equipment. They had people that actually pulled them aside and talked to the members as they come in. And if I'm correct, they actually tried to pull them off if there was something, a scene that went on somewhere that they felt could be very traumatizing. They didn't wait for that to manifest. They actually pull them aside and talk about it at the time. Is that correct?
Yeah, and you know, that kind of leads into critical incident stress management. There's a team right here in Cabell County that I'm a part of, the Cabell County Critical Incident Stress Management Team. Definitely anytime there's been a critical incident, being proactive as possible, like this has happened, let's bring in some support before we start to see any signs and symptoms of a problem. That's really what the CISM model is all about. Let's debrief this so that hopefully symptoms of PTSD don't take hold. Rather than trying to fix it on the back end, let's try to prevent it in the first place. So really looking at preventive measures in addition to the reactive measures, that sort of thing. But yeah, I think there has been a lot of things moving in the right direction. I think Kanawha County EMS is also looking at establishing or reestablishing a CISM team in that area. I know Jody Ratliff has been doing a lot of work focusing on mental health of first responders as well. So there are proponents of this. Now it's just kind of like, let's leverage that momentum. Let's continue to build on this.
My last comment would be more directed to the chair and to the committee, that I would ask that we reach out and ask staff to reach out to further investigate the programs that we do have that's ongoing and some of the areas that she has mentioned, that we can get a report back to us at some point as to what we're doing. And I have to tell you, I always hate to mention this, there's always a cost, so we need to know cost associated with these type of things and actually start working to see what the answer to all these issues are. We know we do have issues. We can't hide our head in the sand any longer, and we can't afford to lose any more of our first responders to this. So I would ask the chairman to ask the staff to dig into it, find out to as many people as we can know all we do have.
Yes, yes, the staff would be more than willing to work on that issue and report back at our next meeting, which will be, I guess, formal meeting probably in August here, I believe. Yes, Delegate.
We used to have these teams all over the state, these teams for critical stress debriefing right after the incident. But we lost support. Risa was in charge. We lost support. As you know, our EMS system has been kind of up in the air for years. I think we finally got it straightened out a little bit, such as, you know, we have protocols that you had to teach all your people by a certain date, or MedCom wouldn't accept your call unless they had your name and all these kinds of things. 3 days before, they said, well, we've changed, we're not going to use those protocols. And those kinds of things, we lost a lot of people over that. But I believe we have got some real good leadership now in our EMS, and they're working on it. As far as the debriefings, one of the problems we always had, I could usually get the EMS, but the fire department guys that help pick up different pieces of people, they said, I don't need to talk about it. And then soon they would be out of the fire department. And there's where we really need, and we tried to get people to recognize this and try to get them to, you need help, no, I'm tough. I don't need this. It don't bother me. All of a sudden, it'll just overtake you like you can't believe. And I think anything we can do to do this, but we have to look at it. It has to be immediate. It seems like if it's immediate, it does the most good.
Yeah, I mean, the sooner, especially if we're talking about, intervention, so something has already happened, definitely the sooner the better. And this is a model, advocating for 24 to 72 hours after that event, if not providing on-scene support. That's one of the components of it. There was a question about models in other states. One to look at, I believe it's South Carolina, that has a very centralized critical incident stress management program. So they have people spread out all over the state, but it's managed centrally as opposed to having, one-off teams here and there.
That's something like that's what I would like to see, because what does the most good when everybody's crying? That's when the biggest intervention is. And 72 hours later, they won't come back in. They've already seen, and they're starting to back away.
Yes.
But a centralized team, I think, would do a lot of good.
I think so too, because centralized and integrated, because, I'm on the Cabell County team. At least as of the time that I started on that team, we were one of 2 teams, at least officially registered with the International Critical Incident Stress Foundation. So we would go as far as we could. We aren't funded, so we can't really afford overnights, but we would go as far as we could drive there and back in one day. So we've traveled up to 3 hours one way. But if we had more of a centrally led system that was more integrated throughout the state, it would be much more accessible to particularly the more rural areas of our state.
And another thing that would help is people aren't requested to go. It's a part of your, no, you're going for this, because you got to make them, because people won't go. And if you would make them go there, then they'll break down and it'll do some good. It's the ones that, you know, especially if it's hours afterward, well, I gotta go to work, you know, so I gotta get out of here. And those are the ones we'll lose.
Yeah, as immediately as we can to ensure that we're, you know, getting to the people who were there on scene is critically important. One thing I can say anecdotally is we've had an easier time getting EMS and fire to show up to debriefings. I think law enforcement has been a little bit more of a challenge. And I'm not sure if it's just the difference in, you know, EMS and fire, they're used to working as a group versus law enforcement tends to be a
We've
little
seen
more
that, we
solitary.
learn to, whenever we practice with law, fire, and EMS together as teams, then we'd switch positions. Law would actually extricate, you know, just in practice, but they see where they're looking from, you know, their different points of view. And that seemed to make us a one team unit when we was out in the field, you know, and everybody understood what the other one's thinking. And it's,
Yeah, so
programs
kind
like
of
that
like
might help.
cross experiential, yeah.
Director, I have one other question. It's kind of dovetails in with Delegate Jennings' statements. What I have noticed in my experience is that, you know, fire, EMS, and law enforcement throughout the state are sometimes on different pages as far as the debriefing. Law enforcement is really hesitant to come to a debriefing because they're afraid of getting away the criminal case sometimes. And so they're hesitant to come to these debriefings without the blessing of the leadership of the law enforcement agency and knowing that, you know, and what they say in there is a confidential, you know, event. I know South Carolina does, they have some remedies for this, and I would ask if you wouldn't mind, maybe as we go throughout the summer, maybe help us explore some of those programs in South Carolina and see where we need to, who we need to talk to. I have some suggestions, but ultimately we need to see who we need to talk to in our agencies throughout the state and see if we can get everybody on board.
Absolutely, I'm happy to help however I can. I think in fact, the person who led my CISM training was one of the leaders in the South Carolina system, so I can try to see if he's still active.
That'd be great. I do know on the state police side, I know he's actually chief of staff now with the state police. Jim Mitchell went to the same training in South Carolina. So you know, I'd like to coordinate maybe some of that.
Sure.
Of course, also with you know, Director Ratliff and some of the fire and EMS personnel as well.
My contact information is here. I have some cards with me as well if anyone would like to have my contact information, and thank you again.
Anybody else have any questions for our speaker? Thank you very much.
Thank you.
Watch the cord. All right, very good. We'll go to our next speaker, State Fire Marshal Kenneth Tyree. He's here to discuss some improvements in the ISO ratings and how that impacts fire departments. Sir, how you doing? Yes, sir. Do you swear that the testimony you provide will be the whole truth and nothing but the truth, so help you God? Yes, sir. Thank you, sir. Appreciate you being here.
Distinguished co-chairs, members of the committee, grateful to be here today. I'd like to make one mention, the recent loss of the Forester. We had to make a request to the Cabell County system team, and they responded to Raleigh County to assist the office there based on the request from Deputy Chief of Staff Earling. And so we appreciate what they did there to help those those staff members under that unfortunate circumstance. But thank you for having me. I will first start off, when I was called, I was out of town about this. And if I had the time, I'd have probably had a representative here from the Insurance Services Office, because I am not an ISO expert, but I'll share the things that I do know and am willing to share, and be able to answer any questions I can and get answers that might be needed. And we realize that the work that you all do is helpful to all the departments throughout the state, paid and volunteer. We know we have a great concern about volunteer fire departments and their needs. But the ISO is the Insurance Services Office, and they do a fire suppression rating schedule that where they rate fire departments and how they're protecting their community. And through that, there's 4 categories that they are really evaluating. One is communications, emergency communications within the community. Secondly is personnel, operating procedures, equipment, and training. The next, and probably the most critical, is the water supply for the community. And I'll tell you, the water supply, if it's not there, it affects the ISO rating significantly. And that really is not a fire department, something the fire department can resolve. It's really comes down to the community and the leadership. And then the fourth is a small category, but it's an extra category. So it's a 100-point system that they evaluate under. And so the fourth category is community risk reduction, and they evaluate things like the inspection programs, pre-planned programs that they have within the department, if they're able to inspect buildings, if they do that, if there are adopted codes, which the fire code is adopted in every jurisdiction throughout the state. And the pre-plan is one of those critical things. So actually it's a 100-point scale, but they have as much as 105.5 points that they can achieve due to that community risk reduction evaluation process. So when we look at how it impacts a community, the first thing everyone has a great knowledge about is insurance premiums, right? And how it impacts the insurance. And it does, it impacts insurance premiums, generally speaking, is what my understanding is. And again, I won't speak for insurance companies, but so about 75% of the major insurance companies do take the ISO rating into consideration when it comes to lower insurance premiums, and it does lower insurance premiums. So there's a 10-point scale for ISO rating. A 1 is the best you can receive, and the 10 is the worst. And that evaluation is based on various things: location of fire departments, the water supply, residential, commercial structures, and their relative proximity to water supplies and the fire department itself, response, how they operate at the scene, how fast they get there sometimes, and really personnel is probably the biggest thing that impacts. So when it comes to personnel, operating procedures, equipment, and training, that's 50 points of the 100-point scale. But the water supply is 40 points, but it's probably the most impactful, because if the water supply is not there, there is no really leverage or consideration, anything that can be done to improve them above 65 points, really, depending on what level they're out with the water supply. 2 other things, basically, ISO ratings. I was in the paid fire service for nearly 22 years. In some ways, it was kind of a badge of honor to say what your ISO rating was, okay? I lived in a volunteer community. Most of all those years, I was on the paid fire department. And I had a good volunteer fire department that served our area. My rating wasn't that good, but my insurance, I don't think, was impacted as much on the ISO rating as it was the proximity to the fire department that was there and the location of fire hydrants within my subdivision or a residential area I lived. I really don't feel that the fire department was the cause of anything when it came to the insurance premiums in the area that I personally lived in. And then, so how to improve the fire department's ISO scores? Well, as I said, first and foremost, the water supply is probably going to be the most critical key. The other things take care of themselves if you're able to recruit, and I'm talking about volunteer fire departments. We're able to recruit and retain people, the personnel, staffing, training, the ability to get to an incident takes care of itself. And but we all know that we're under some concern with volunteerism in general, okay? We don't want to pick on volunteer fire departments. Volunteerism in general has decreased over the years. And there are several things that impact that, whether it comes to two-income families, other commitments, family commitments, other fraternal commitments, church commitments, all these different commitments that have taken away from volunteerism. And relatively speaking, in the state of West Virginia, communities are well represented with fire departments, but some of the staffing issues are really what is at the forefront of the concerns, okay? And a lot of things can impact that. And so when you think about water supply and then the other portion, I believe the personnel and staffing, the operations, response sometimes exceeds the water supply concern. I mean, it really has an impact. And I can't speak, I've never evaluated a fire department in that regard. We have evaluators that do fire department evaluations, and but the ISO rating is not one of the things that the state law requires us to take concern to. And so I wanted you to know that. So probably the last key of how you can improve ratings are tracking, and the tracking of all those things that I've talked about: incident response, personnel, staffing on scene, training requirements, whatever they are, those things, when they are tracked and you have that information to provide to the ISO, the Insurance Services Office, your rating cannot be anything but better. But when you lack that information, it's not going to be as helpful to that department, which really we're talking about the community, because the ISO rating doesn't only deal with the fire department or the fire suppression rating schedule. There's other things that are in that community rating that is involved there. The fire department's the one that ends up with the rating, but it doesn't necessarily just lie with the fire department itself and what they provide and how they protect the community. So that is what I had to present based on the knowledge that I was given being out of town how the ISO rating or how to improve the ISO rating and how it impacts the fire departments. I guess as I conclude and prepare for questions, I would just like to thank this committee for always taking a strong consideration to the fire and EMS issue. The fire departments, as you all know, because you're out there, have great needs. They're deserving of all the help they can get. And I'm grateful to have the 8,300, estimated 8,300 volunteers throughout the state to serve in all of our communities to help affect change and really to keep people safe is really what it comes down to. If I do nothing else as the senior state representative for the fire service, is if we can keep people safe and they can go home, I will sleep well. And so I thank you for this opportunity and will entertain any questions that you might have.
Yes, Senator Rick Phillips.
Thank you.
Sorry.
It's my understanding, if you got a fire station here at 5 miles out, the ISO rating changes to bad. Is that correct?
I'm not for sure the exact proximity. I know the further that the fire department is away from the residential or commercial area,
Change.
it changes, the rating changes. So, and really it comes down to also response times. I mean, and so response times, depending on where you're located, that's going to affect it. So it's several things that will affect it, but geography and distances and proximity is one of those.
Where can we see each fire department? Where can we see those ISO ratings? Or can you provide them to us?
So years ago, I tried to get all the ISO ratings just so I would have them to be able to retain them. ISO will not give them to me in a bundle. So they just, but each fire department has their rating. If in your area, if you go there and ask them what their ISO rating, they will gladly tell you. It's not one of the things that, and you know, there's departments out there that are a 10, and it's for whatever reasons that ISO's identified that they're a 10. But you have a lot of volunteer fire departments that are in the 4 to 6 range, which is, it's very,
I think something, Mr. Chairman, if we could get something like that in front of us to where we could see it, it would help a lot of making our decisions on moving forward on legislation.
Yes, sir. We'll discuss that with council and we'll provide that hopefully at our next meeting.
Okay, thank you. Thank you, sir.
Yes, sir. Yes, Delegate Jennings.
Do you know if tanker shuttle is considered as water supply?
oh, absolutely. They,
If your group, practices, then it will be considered. In our department last week just got checked for ISO rating. They told us it was 1,000 feet from a fire hydrant is how far away to get that one. And like you said, it was personnel on the fire scene. It wasn't the personnel that was, on your roster. It was the personnel that made it to the fire scene for that. And we're trying to get it. We feel we're trying to help out our people in our area, trying to get our ISO rating lower is what we're doing.
absolutely. So pertaining to that, they do evaluate if you have mutual aid, automatic aid, all that's taken into facts, taken into consideration. And the largest thing is if you can validate that basically through your CAD reports. As long as fire departments are reporting properly, their staffing and that type of thing, they're able to get that credit when they may not have all the personnel that they need within the department.
Yes, Delegate.
Thank you, Mr. Chairman. Thank you, Commissioner. What's the administrative burden for volunteer fire department when they're trying to turn in the information they need to regarding their ISO?
So, I mean, I guess the administrative burden is they're, and I say this with all the respect in the world, they're volunteering. They're volunteering their time without compensation primarily. And so they have other priorities, getting back home to their families' work. And so sometimes, and I will say it's minimal, but sometimes reporting goes undone. And so sometimes that person responsible for doing those reports that, well, we require reports from Chapter 8, 815, 8A as a part of the disbursement they receive. So over a 180-day period, as long as they get them in, they're going to be in good standing with us so that we can share that with Treasury and Treasury Department so they can get their disbursement. But I guess their administrative burden is really sometimes personnel not putting their reports in as much. I can't speak to the financial accounting piece
I guess
administratively.
my question is kind of more, is there the paperwork that has to be submitted to ISO that a chief would do or staff would do? I mean, what all is included in that? Is it just, you're mentioning reports that they have to send to you all, but are there other things that are maybe duplicative of what you require that specifically has to go to this organization?
As long as they're retaining, and again, I'm not an ISO expert, but I can share this. As long as they're retaining their staffing rosters, their training accomplishments, requirements they've met, equipment, what equipment they have, the maintenance of that equipment, whether or not they're performing pre-plans in their community, inspections, those types of things. As long as they're retaining that when they're doing it, they're really not per se lacking anything. It just may be based on how much they're doing in the area may affect their rating.
And Mr. Chairman, this may not be the best question for now, but I know one piece of information, or at least one issue I've heard from some chiefs in my area has to do with ISOs, making sure that they provide the information for them, but then having certain insurance companies use zip codes versus using the ISO rating. So they do the work to turn in this information, they try to get the best ISO, but then it doesn't even count towards the insurance with respect to certain areas. Like, for example, in Fairmont, you have a 26554, Phil knows this, zip code that covers Whitehall, that covers Fairmont, that covers other areas, which all have different aspects that aren't necessarily the same as what maybe an ISO would be for a certain volunteer fire department. I'd be interested in hearing from an insurance company and from also, there's a specialist to talk about why some insurance companies don't use ISO, or is it the best way to have that information to help out with rates? Thank you, sir.
Yes, sir. Thank you. And I'll ask council to look into that, and we'll try to present something as soon as we can find an expert to present to our group. Yes, sir.
Thank you, Mr. Chairman, and appreciate all the information. I'm curious on the ISO rating, and we talk about insurance costs to homeowners. What kind of fluctuation are we talking about if you're a 1 to a 5 to a 10? I mean, is that roughly 10% each point? I mean, do you have any idea of that?
I do not. I'm sorry, I don't. I would love to know that because, for example, there was a time when I was living in an area that was a 10, and now I live in an area that is, I think, a 3. It's either a 2 or a 3. And I mean, cost-wise, I mean, it was my insurance really didn't change much. I mean, honestly, it honestly didn't. So I don't know how that, and I think it's just insurance companies. It depends on the insurance company and if they recognize ISO or if they don't recognize ISO. I really think that's what it comes down to, because all don't use the ISO system. I guess there's some other systems out there, and it may be exactly zip codes that are being used in some areas and not ISO.
This might be a dumb question, but is ISO state or federal?
Well, it's a for-profit company, and I guess you would consider it, it's a national,
Okay.
it's a national company. And actually, our last commission meeting, the person that's over ISO for this area, West Virginia, Ohio, Pennsylvania, I think Michigan is in there. He was there, so I mean, I'd be glad to make sure council has this information so he can.
And I guess I would be curious of what other criteria, so I sat here, I took all this in and I thought every insurance company is going to use ISO. So we're going to focus on that because we want that score to improve. Well, now that we find out there's other players in the game, I think it would be useful if we knew that. Is it the same criteria? Or do we need to focus on, you're saying this is 40% water source, is the other guy that's evaluating it, is there's 80% water source? I mean, I think that is hard, as Delegate Garcia was saying, he's got different ratings going on in his community. So I appreciate that we focused on ISO, but I think if there's other aspects that we need to look at that maybe we need to collect all that data together.
And I'm not even aware of the other companies. I can just be that transparent. I mean, ISO has been around for many, many, many years, and my assumption was that everyone used it, but I found out a couple years ago that necessarily everyone wasn't using their system to take that into consideration, the fire suppression rating schedules.
Very good.
Okay, thank you.
Very good. Thank you. At this point in time, we'll have to conclude our questions because we do have one other important matter that we want to get to before the 4 o'clock hour. We do appreciate you, sir.
Thank you.
So much.
Thank you very much.
All right, very good. I'll ask council if we've established a quorum.
We have.
We have? All right. Very good. We'll have to, I'll ask, the chair will recognize the vice chairman for the approval of the minutes.
Mr. Chair, I move approval of the April 18th, 2023 meeting minutes.
All those in favor say aye.
Aye.
Contrary, no. It appears the ayes have it. The ayes do have it. And so ordered. The next item on the order of business is House Bill 3153. It's just discussion of the revised bill. And for us today, we have Council Philip Childs here to discuss it.
Thank you, Mr. Chairman. Members of the committee, House Bill 3153, I believe most of you have seen what is our working copy. What this bill does is first it creates consistency throughout the code where the Fire Protection Fund administered by the State Treasurer's Office was administered inconsistently before. This corrects that. The other thing that it does is, and I will actually look to Director Taylor for a second, it does not affect in any appreciable way the Municipal Pensions Oversight Board and the municipal pensions from the firefighters' pensions. It does create a 1% surcharge. I'm sorry, it does not create a 1% surcharge. It increases a surcharge on casualty insurance premiums from 0.55% up to 1%, that 0.45% being split equally between EMS fund and the fire protection fund. So it increases money to the fire protection fund also for the EMS. Were oversight provisions from Senate Finance this past session put in there. One being that right now, in order to qualify, be eligible, the fire marshal must submit the names and addresses of each fire department, volunteer fire department, or part volunteer fire department to the treasurer, as well as how many, what the proportion is of paid members versus volunteer members. The other thing is now a 2-year look back on all of their revenues and expenses must be submitted to the treasurer in order to qualify. Also by recent change from the bill, by January 1 of 2026, all of these volunteer fire departments, in order to remain eligible, must get up on the auditor's checkbook accounting system or accounting reporting system. That is the crux of the bill. I can answer any questions of council. Thank you.
Anyone have any questions from council?
Just-
Chair recognizes the vice chair.
Just one quick clarification. The date that he just read to you on the 26th to be on checkbook, I actually myself asked if that be extended to the 28th. I thought we had a working, and it is a working document, so I thought we had an agreement, and it appears we don't have. So when that comes out, it will remain 26, but when it comes before the groups, I hope we at least put in there that if the auditor's office is working with some fire department or whatever, and are having trouble getting up to date on it, that he can make mention of that and we can give allowances on that. And I do have a working agreement on that one, so.
Very good.
I just wanted to clarify that, Mr. Chairman, because I made a statement to the folks that I thought we did have that agreement.
Yes, yes, Senator Phillips.
Thank you, Mr. Chairman. I want to go back on what the vice chair said. When the bill come before the Senate committee, the state auditor was there, and also the fire departments was there, and they all agreed 2026 was plenty of time to get stuff put in place. But I agree with the vice chair, if there's some fire departments that are struggling with location and getting that I would support extending it beyond.
Thank you, sir.
Thank you.
Any other, yes, Doug?
Thank you, Mr. Chairman. Council, on the rate increase, you said it's going from 0.55 to a full 1%.
That's correct.
Okay, is that in the bill somewhere? Because all I see is the 1%. I don't see where like 0.55 is marked out and the 1 replaces it, or.
So there are two surcharges contemplated in the bill. The 1% has always been there and is not changing. That is the one that affects the pensions. The 0.55%, hold on, I have to find it here.
Was that on 13 then?
Thank you, yes. Oh, actually, there is one on 13, there's also one on. Oh, okay, yes, delegate. So on page, if you look on page 8 and 9, so the way that it was written, so it didn't cross out 0.55 because through December 31 of this year, it is still 0.55. On subdivision B of subsection 3, I might be wrong about those titles. After December 31, 2023, for the purpose of providing additional revenue for volunteer and part volunteer fire companies and departments and emergency medical service providers, hereby authorize and impose on the policyholder a policy surcharge equal to 1%. So that it's not a cross out and insertion. It is just a brand new section that says after December 1, January 1.
Okay, so if I understood you correctly, the 0.55 was expiring or something, so.
According to this bill, it will expire on December 31. But it was not, I mean, it's only by function of this bill.
Okay, and that was on page 8 somewhere?
Yes, page 8, very bottom, that subdivision 3.
Okay, and what's the total dollar amount?
This,
At the 1%.
it would result in an increase, and not an exact figure, but it's in the $12 million range to be split equally between the Fire Protection Fund and the EMS.
Okay, and back when we passed this bill during the regular session, there was a dollar amount going to each department. Do you remember what that was?
It's, again, roughly just shy of 20 grand, I believe. 50? 15, excuse me.
15.
For the 24/5.
All right, thank you, Mr. Chairman.
Yes, sir. Senator Phillips?
Yeah, this bill still, has in there for the EMS training and so forth, correct?
That's correct.
Yes. Very good. Any other questions? Comments? Is there, any questions from anyone in the room? We are fortunate we have, some other representatives here. We have Chief James, here as well. Anything else from council? Anybody else?
Sounds good.
Sound good? All right. At this point in time, now we have to consider that this is a working document. You know, of course, since we're in interims, we can't pass out any legislation, but it would be considered a working document. What would be the pleasure of the
Mr. Chairman, I would move that we put this working document out for both houses to take a look at, to move forward on, as presented to us.
as presented to us and present this to Mr. Speaker and Mr. President? Is that correct?
That's correct.
Mr. Chairman, one more thing, with the agreeing of the committee and everything, I think it's pretty important if we have a special session that, we get the speaker and the president to encourage the governor to put the legislation on the call list. I think it's pretty important to get it moving.
Yes, sir. So let me make sure that, can you clarify your motion? Would that be okay, Senator Phillips, to let him clarify his motion?
That is clearly what a motion is put out to do, is to put this piece of legislation out there to ask the chair or the speaker and the president to move on this piece of legislation into a special session. As a working document, this is the way the committee would send it out. And under our agreement, this is what we say that we would like to see moving forward. And I will tell you, that's already been discussed with both sides, and they are okay with that.
Is that a clarification on his recommendation? Was there a second to that? Okay, the Delegate Jennings? Just call it. All those in favor, say aye.
Aye.
Contrary, no. It appears the ayes have it. The ayes do have it. It'll be so ordered. Is there any other business before this committee?
Mr. Chairman, I move we adjourn.
Been a movement for adjournment. All those in favor say aye.
Aye.
All those opposed.